Thank you, Governor. We want to build on that message of hope. Thank you all for being with us once again. As the Governor said, we have 101 new cases to announce today. If you recall, we announced 67 new cases yesterday. The fact that these numbers have been relatively low is definitely an encouraging sign. There are 188 people with COVID-19 currently hospitalized in Rhode Island. We have 48 people currently in the intensive care unit and 31 people on a ventilator. Sadly, we have 12 additional COVID-19 associated fatalities to report today. 4 people were in their 70s, 2 people were in their 80s, and 6 people were in their 90s. Our sympathies and our prayers are with the families of these Rhode Islanders who we have lost. As the Governor highlighted, this is a challenging time. It's a tough time for many, many people. It's a lot to process as well, and being able to understand what you can do to get through these times, to get through it safely from a COVID-19 standpoint and beyond. We spoke yesterday about the higher percent positivity in certain communities that have a more dense population. It's important to recognize that there is also a distinct association of communities of color having higher rates of COVID-19 as well. We recognize that there are inequities in our communities that can go back many, many generations. There are inequities that have been experienced by people in my family and in the families of people throughout Rhode Island. So it is part of public health as we address COVID-19 and all that's surrounding it, to be able to call out structural inequities such as racism, institutional racism, and other components that contribute to the different outcomes that we're seeing. If someone is exposed from birth through adulthood to systems and policies that can be discriminatory, there is a challenge in what happens with outcomes, and that is exposed in situations like we're seeing with COVID-19. Those inequities influence health outcomes and life outcomes for communities of color, in particular, African Americans, and communities of color significantly overall. We see evidence of this today in what's been happening nationally and what's happening at the state level, and it's playing out when we're impacted by COVID-19. There are gross disparities in the way in which COVID-19 is affecting Latino and African American Rhode Islanders. We have to call that out so that we can think through how we can address it. It does include what we have been talking about, making sure that we have the proper translation services and communications for communities of color, making sure that we have the expanded testing that we've worked very hard to obtain and ensure access to with communities of color, making sure that the contact tracing and quarantine and isolation supports are in place. But there's also an opportunity for all of us together, from a public health standpoint, to address the structural inequities that are underlying why we see those differences, to call out racism, to call out any of the other policies and systems that are discriminatory, and think through what each of us can do to address that. We have a valuable resource that's one of many possibilities here in the state to be able to respond and recognize that it's not just one community in Rhode Island that's impacted. When that happens, it's all communities in Rhode Island. Learn more about health equity zones in Rhode Island. We have information posted at health.ri.gov/HEZ. The Governor has been an enormous supporter of our health equity zones. Health equity zones are building health at the community level, the broad understanding of health, not just health care, but looking at housing and transportation and employment, all of those components that contribute to why we're seeing COVID-19 disproportionately impact certain communities over others. We are investing so much in this type of place-based approach because we address structural issues like housing and education and employment and other community-level factors, so that communities are not as vulnerable to issues like COVID-19. We recognize the importance of making sure the voices of communities are heard, so that no one's health is determined by their zip code, their race, ethnicity, gender identity, sexual orientation, or level of income. It's our credo at the Rhode Island Department of Health and across the governor's entire administration. We clearly have a lot more work to do as a state and as a country, and as the governor has said, this work is about collaboration and about partnership and about being kind, recognizing where each of us can make a difference, whether it's COVID-19 or beyond, understanding the policies and systems and structural inequities that we can change together.